Hi, I'm Justin Cohen, and I'm honored to introduce our article, Effects of Intravenous Tranexamic Acid During Rhidodectomy, a randomized, controlled, double-blind pilot study. This was done with the support of my co-authors, Dr. Mark Glassgold, Dr. Robert Glassgold, and Dr. Les Elogiou. As one of the hottest topics in plastic surgery today, it's hard to find anyone who isn't at least a little interested in tranexamic acid, or TXA. Some are even claiming that TXA has completely transformed their practice. But TXA is nothing new. First invented in the 60s, TXA is a potent clot stabilizer that helps to decrease bleeding. And it has revolutionized care for a wide range of medical specialties, including obstetrics, trauma, cardiac surgery, orthopedics, and many more. Within aesthetic plastic surgery, however, the majority of the buzz is based primarily on anecdotal reports and a handful of published clinical experience. So we designed a prospective, double-blind study to investigate the effects of IV TXA during a facelift. And the results were not necessarily what you'd expect. Probably the most important takeaway from our study, we found that while patients who received TXA experienced a statistically significant decrease in postoperative bruising, the actual intraoperative experience wasn't all that different. This means that TXA may not be your savior, and surgical technique, including careful hemostasis, remains paramount. If you are looking to implement TXA into your practice, our protocol is outlined in the article, and you're welcome to use it. However, I encourage you to arm yourself beforehand with as much knowledge as possible and consider introducing it in a blinded fashion to see if it truly improves your outcomes without bias. There are several ways you can use TXA in addition to IV. These include oral administration or as an additive to your local or tumescent. And there are several published studies describing these as well. Going forward, it's clear that TXA shows significant promise in the field of aesthetic surgery. However, much is needed in the way of high-powered, controlled studies to investigate optimal dose, timing, and method of administration. On behalf of my co-authors, I'd like to thank the Aesthetic Surgery Journal for allowing us to share our work. I sincerely hope you enjoy reading it. Thank you.